degranulate based on certain stimuli, chemotactic factors. Some of them can just degranulate mechanically. If you scratch somebody who has a tendency, then they're going to have red streaks. That's a mast cell type reaction. Heat in some people, but mostly it's chemical means based on an IgE reaction, immunoglobulin E. And the way that works is the IgE has affinity for certain allergens, and then when it binds with it, it's capable of attaching to the surface of a mast cell or basophil, and they degranulate. And so then you have the histamine response, which is a swelling, inflammation. You have increased permeability of tissues, an inflammatory reaction. Why is this important? Well, most of the time in nature, the same as pretty much with every other modern disease, allergies don't really exist. Allergies are really due to the fact that in modern life we separate ourselves from nature. And I'm not saying it in a Shangri-La kind of a meaning. You know, nature contains a lot of toxins, irritants, things like that. If you get exposed to them early, then your body learns to deal with them. If you don't, then you end up with modern human beings who basically are like, you know, the little pupa in the cocoons, where if you take them out, then, you know, they can't survive on their own. We're basically soft, fleshy, you know, puffy little creatures, you know, just ideal for predators because we're helpless. And allergies in particular happen in children even now at a fairly low rate, so we're even more helpless because, you know, lots of mothers are nuts. Lots of parents are nuts. So they make up this stuff and then they take their children to doctors who are also nuts, and then they are diagnosing these people with things that don't exist because true allergy reactions are not common. Most of what you know as allergies are in fact symptoms of something else. Let's take the classical one, which is nasal congestion. This is the number one considered thing. You have ragweed pollen in the air, and now you're allergic. Well, most people are not. What they are is they have what's called vasomotor rhinitis. 95% of people who claim to be allergic or are told that they are allergic, in fact, have what's called vasomotor rhinitis, and that is a reaction to not getting enough sleep. What happens is that your nasal mucosa at baseline tends to be somewhat swollen and relaxed. It's actually sort of analogous to a smooth muscle, which has some tonicity to it, but it depends on the nerve supply. It is not like your skeletal muscle where you can decide where you put it and where you put your hand. It's just something that either contracts sort of to a certain tone or relaxes. In the nose, this is determined by sympathetic nerve fibers. And if they get tired, if they run out of neurotransmitters, then your nose gets congested. So if you don't get enough sleep, these nerves get tired. And what you end up doing is using a nose spray or taking antihistamines in order to decongest you. But then what happens is you're degranulating and you're exhausting these nerve fibers even more. And so then you get into a vicious cycle where you need more medicine. Why is this important? Well, clearly, it's not an allergy, so it's a very poor treatment to try to take decongestants when you should just get some more sleep or lower your stress level. We don't, and therefore the treatment doesn't really work, so then you just take more treatment, and that's how you get again into a vicious cycle. The other thing is the treatment, of course, is somewhat soporific, meaning it makes you sleepy. There are certain brand names like Allegra and I can't even think of the names of the various medicines, but they claim that, you know, they don't make you drowsy, but they all do, which I guess doesn't really matter because then you get into your Tesla and, you know, it'll drive for itself and run you into a stationary truck, and so life is good. and you're sleeping while you die. So we really have a very bizarre existence if you really think about it these days, and kind of surrender our autonomy. Well, that's what we do with allergies. So why would it matter? Well, it matters because number one, it's inaccurate, and as a professional and also as an engineer, I don't like inaccuracy, so it really bothers me. The second thing, however, is that once you start saying allergy, you're basically doing bad things to, like, kids. Like, lots of kids are diagnosed with allergies. Their pediatricians couldn't give a damn. I mean, just witness all the stuff about sex change and all the other insane things my colleagues do. And what they do is they sort of reinforce this narrative. So now you have kids who are on medicines long term. Again, does it make a difference? Well, maybe not much. They're not going to get killed or get cancer. But why would you be drugging kids up? Same as ADHD. Why would you be giving drugs just because a kid's inconvenient? We do that all the time. And so that's not good. The other thing is, however, that lots of times people are misdiagnosed with allergies when in fact they just have a side effect to something. Let's consider the fact that if you get into a pool or into a jacuzzi, your nose is going to be congested within a couple of hours after coming out. And why is that? Because the chlorine is caustic. So again, it's not an allergy, it basically is caustic. If you move to a dry environment that's hot, New Mexico, Arizona, places like that, or down in Mexico, inland, then your nasal mucosa will dry out and it's going to get chafed. And then what's going to happen is you're going to get, again, nasal congestion. Allergies, of course, it's not. So you're treating things that have nothing to do with allergies or the histamine mechanism. In my particular case, however, as a doctor, you're telling me you have allergies can risk your life. And that's basically the greatest problem with this. We can afford to give tons and hundreds of tons of useless medicines to people because we can manufacture them and it won't kill you outright. So that's not a primary concern. The primary concern is when people who have side effects then are told, or they themselves declare, that they're allergic to something. We may be talking about life-saving substances, and the classical one is penicillin. A certain portion of the population is allergic to penicillin. It's rare, but it does happen. Now, allergy, again, is not stomach ache. It's not, I had a headache or whatever, or I took Motrin and, I ended up with worms in my butt. What we're talking about is a histamine-based reaction, swelling, anaphylaxis. Anaphylaxis is really rare as hen's teeth. Remember, your ancestors, if they had anaphylaxis, they died. So selectively, anaphylaxis is not something that really occurs much in nature because it's not compatible with life. And you didn't have EpiPen even 100 years ago. So if you truly were allergic, you probably didn't make it to reproductive age. On the other hand, today, we declare all kinds of stuff as allergies, including penicillin. And by the way, remember also that penicillin exists in the forest. Any humid environment will have fungi, and it's going to be rampant. You can actually smell it sometimes when you go into a humid environment in the forest, in a jungle, or in a tropical area, because it's all over your environment. That penicillin smell. So we're exposed to it in nature. But because we're not exposed to it as young children anymore, and we have these studies that anything you're basically exposed to before the age of about 6 months old, you're not going to be allergic to. Your immune system learns how to deal with it. So all those kids who grow up in places like Kenya and Uganda and Cameroon and Burundi, they don't have allergies, and if they do, it's made up. And the reason is because their body has learned to adapt very early. In our modern culture, we do. But as I stated, it's still rare, true allergy. But when you come into the hospital, you were told that you had an allergy to penicillin, so that's what you tell me. Rather, you tell the nurse who does the intake. Once it's on your record, I can't take it off. If I do, I'm going to lose my job, or you're going to sue me later on if there's any problem, so I can't risk it. I know you're not allergic to penicillin, and most of the time it doesn't matter. But you do insist you want that on your record, and I'll have it on your record, because if I give you penicillin and you have a reaction, guess what the nurses will do? They'll put it down, and they'll also say that I gave you a medicine to which you were documented to be allergic, or rather, I forcefully took it off of your record. Did you have an allergic reaction to the penicillin? No, maybe your stomach hurt or you had some other side effect. That's a side effect. But still, I'm going to be told that I did something wrong, and then I'm going to be fired. Or worse, I will get sued. So why is this important? Well, it's important because much of the time, the best medicine for you as an antibiotic is a penicillin or something related. And as I explained in a prior video, antibiotics are life-saving. It is 50% of hospital admissions are antibiotic, or for some kind of an infection for which an antibiotic is indicated. If I can't give you a penicillin, then you will both spend longer in the hospital, because penicillins are exquisitely cidal. In other words, they kill the bugs very well, much better than just about any other antibiotic. And so if I substitute, even if the other antibiotic works, it doesn't work as quickly. The other thing is, in some settings, the other antibiotics will not work, and you're going to end up dying. And I've seen that before too. There's nothing I can do. Now, I can give related medicines, they're called penims, so carbapenems, like meropenem, for example, excellent medicine. However, most of my colleagues and a lot of pharmacists will not give it to you. And why is that? Because they don't understand that the cross reaction is not predictable, and it's rare again. So you start out with rare allergies to begin with. In other words, most of the people who tell me that they have allergies to penicillin don't. And then on top of it, it's only about 1% cross reaction if you have a minor allergic reaction such as skin between penicillin and a carbapenem. If you have a major cross reaction like anaphylaxis, then it's about an 8%. It's a reasonable chance to take, and we can deal with these things. If you have an anaphylactic reaction in the hospital, it's not a big deal. We can get to you immediately and treat it, and you are absolutely fine, and then we know we can't give it to you. But most of the people in the hospital, and lots of times pharmacists, have prevented me from giving a drug that is eminently givable. It depends on the hospital. Many hospitals are very poorly run, and they are fiefdoms where, like, let's say a pharmacist can just tell you, who is a poorly trained and, again, ignorant person who only understands a little part of the whole picture. I hate to be so critical, but consider the fact that an entire industry, again, is devoted to a disease that effectively doesn't exist. And it also gets escalated in the sense that in the United States, we are now permitting pharmaceutical ads to the consumer. And so you start seeing things like certain drugs, they're called immune treatments, basically being administered for minor nuisances, like drugs for eczema, skin diseases, psoriasis, which can be a life-threatening disease, but mostly is not. These drugs being way more risky than the original disease. I mean, many of these drugs can give you brain infections, can cause cancer, and they kind of de-emphasize it, but the incidence of these problems is not trivial. Basically, they mess with your immune system, and some of the changes that they cause are permanent. That's how they work. And so you're basically having this stuff marketed directly to the consumer. Only 2 countries in the world allow that, New Zealand and the United States. And New Zealanders generally kind of block this out to some extent, so it doesn't have the same effect. Plus, they have a nationalized healthcare system. So the general effect is very different. In the United States, people will actually ask for these medicines, while at the same time they can't give it to themselves. And I posit that it should be the other way, which is everybody should be able to, without the doctor, prescribe to themselves, as long as you keep a register of the medicines being given, and the pharmacist has some kind of a veto power to say, this is not okay. We now have databases where we know, what is acceptable, what is not. We can issue the right cautions. And lots of times we waste enormous resources because people have to go to their physician to get an aspirin or something trivial. And that's ridiculous. But in terms of allergies, you should not be able to get these immune modulators, because if you have a skin rash and you're taking a medicine that's going to kill you, especially if it's for a child, then you're no longer practicing medicine. Because the first dictum of medicine is first do no harm. And if you're doing harm or risking harm for something that's trivial, then you're not practicing medicine, as far as I'm concerned. In either case, I hope that I have made the point that allergies are not side effects. Basically, when you go to the hospital, there isn't a single hospital I have ever worked at, and that's quite a few of them, where they make that distinction anymore. At the beginning of my career, again, because of intellectual rigor, I insisted that we make the separation and the difference. But you can't win. It's like trying to swim upstream in a waterfall. It just can't be done. And these hospitals don't care about accuracy. They just want their documentation, which is just a mountain of crap, absolute garbage. And so because of that, once you do state to somebody that you're allergic to a drug, you're not going to get it. And if you don't get it, in many cases, it might be the difference between life and death. So we have to be very careful about these things. And more than that, as I stated at the beginning, you're not going to get symptomatic relief for things that are not allergic if you don't know their real cause. So just remember vasomotor rhinitis. Remember that a side effect is not an allergy. And if you do insist on allergy, or if your doctor wrongly tells you that you are allergic to something, then that's risking your life. So hopefully this video will be helpful, and thank you for listening.